If you are a patient who is suffering from gums that peel off and leave a raw eroded surface, leaving you bloody at the same time in pain, this episode is for you. Hello and welcome to the Oral Health channel. I'm your friendly neighborhood dentist Dr. Rudra Mohan, and today we are going to be talking about desquamative gingivitis. Let's start. So today we are going to be talking about desquamative gingivitis, and let me tell you first of all, desquamative gingivitis is not a disease. It is a clinical finding that we dentists often diagnose and see, as a presentation and not as a disease or an ailment or a lesion. Now what happens in desquamative gingivitis is very simple. If I have to break down the wordplay, desquamative means any sort of clefting that occurs in the layers of your oral mucosa, and gingivitis is basically the location around your gingiva or the gums that leads to inflammation. So there are many causes of desquamative gingivitis, but I'll tell you one thing. Usually it actually presents as an allergic reaction to probably a change in toothpaste or maybe some condiment that you have consumed, and usually it will present as a lichen reaction. Otherwise, there are some conditions that are associated with desquamative gingivitis such as lichen planus, pemphigoid, and other diseases. But any sort of diagnosis is actually finally established after either a biopsy and a direct immunofluorescence test. So what happens in desquamative gingivitis? Usually patients present with the symptoms of burning sensation and bleeding in the mouth, where a part of their gums feels swollen. At the same time, the superficial layer peels off, leaving a raw, eroded and painful surface. So usually it is presented in patients who are above the age of 30 or 40, and also it is usually seen with people who already have some sort of autoimmune disorders. Now let me tell you that it is also associated with stress. So if you're a person who's high strung and takes a lot of psychological stress, I would highly recommend to dial it down a bit, because there's a high likely chance you might get this. Some of the diseases and conditions associated with desquamative gingivitis are lichen planus, pemphigoid, pemphigus and many others, which also might have some dermal component. So if you do have some lesions on the skin, it's better to also get a dermatologist's opinion. Now the best way to diagnose the lesion or the condition when it comes to desquamative gingivitis, the best way is to go for a biopsy. However, even before going for a biopsy, we generally do try some empirical treatments such as topical corticosteroid therapy, or if the lesion is too severe, we probably go for oral systemic steroids. At the same time, antioxidants and natural supplements. We also make sure that any sort of chronic irritation in the form of smoking, alcohol, tobacco, all those things need to be avoided. Your diet needs to be as bland as possible. Also, once the diagnosis is made, we can go ahead with the proper treatment planning. Now when it comes to desquamative gingivitis, it can be a very harrowing experience for people, and I understand my empathies to all the patients who have that. But let me tell you something, generally it is not precancerous, but then again we need to find out what the exact cause is. It could be allergic or it could be autoimmune. Autoimmune is basically when you have antibodies that are produced in the body against the body itself. Also, what is the difference, you might ask, when it comes to desquamative gingivitis as to why this finding is so similar for a lot of conditions? Let me tell you how this works. That is why a biopsy is required. It's as simple as that. Whenever the desquamation or the sloughing of cells or the cutting off of the cell layers basically happens, how it happens, let me explain it to you. You have a deep set connective tissue, and on top of that you have a layer of cells known as epithelial cells. Now what happens in this epithelial cells is basically you have a basal layer and you have different layers that go up on to become more keratinized or whatever it is. At the same time, these cells, wherever the clefting actually happens, that's where we get the diagnosis from the biopsy. Let me explain how it works. Apart from other histopathological features, that is not the agenda of this episode, because it is directed at the viewers and the audience of layman population. So basically, wherever the clefting would take place, either above the junction of the epithelium, in the epithelium, or below the junction of the epithelium, or in the connective tissue, that is actually confirmed by histopathology or microscopy as we call it, to see, once we take a biopsy of that area and we observe it under the microscope, the level at which the clefting takes place and other changes do take place. That's where we establish a diagnosis. Also, direct immunofluorescence is a fluorescence test where we use dyes, which are fluorescent dyes, and we pass them to a fluorescent microscope, and the area which is the offending area, basically the area where the whole problem is happening, will eventually light up in the fluorescent microscope, and we will be able to establish a diagnosis. Once the diagnosis is established, then we further ahead go with the treatment. Usually the empirical line of treatment is topical, as I've told, the topical corticosteroids and then systemic steroids and some medications. Usually it takes about 3 to 6 months, but in a lot of cases, there might be some remission followed by again exacerbation of the disease. And what we need to do is more of a wait and watch approach. So every time a person who comes with a desquamative gingivitis finding in my clinic arrives into my clinic, I make sure that we keep a very good rapport and a connection, and we keep a very good follow-up, because follow-up is key. We want to know what is exacerbating the episodes, and we want to know how you are doing. So follow-up is key in a lot of these patients. At the same time, we have to make sure that there are some lifestyle modifications that we need to do to your diet. At the same time, any habits which might be contributing to the deterioration of the oral mucosal surface. So that's it for today. Please like, share and subscribe, and please make sure you hit the bell icon so that you get important updates about the episodes. I'm going to make more episodes in English because I know that the fan base has become a little international, and we want to cater to all sorts of people who speak all sorts of language. So I'm making sure that I make more videos in English, and please make sure you like, share and subscribe. Thank you.